February is American Heart Month, and we are so proud here to support the efforts of the American Heart Association. It's especially important to me, as many of you know, my son was born with a congenital heart defect, so I've seen firsthand the work the American Heart Association is doing in our communities to help families. One of their initiatives can help all of us. It's called Nation of Lifesavers. Their goal is to teach one person in each household how to perform hands-only CPR. It could save a life. That's what we're doing here today. So joining me now is Travis Sloan from the American Heart Association and Eric Shabilsky, EMS coordinator with the Madison Fire Department. Thank you both so much for being here.
Thank you for having us.
Such important work you guys are both doing. So we are going to get a demonstration on hands-only CPR, and hopefully those of you at home will now learn through this demonstration. So I'm going to step aside and you guys take it away.
Okay. So Travis and I are out in the community, and we happen to come across someone who's down on the ground. So the first thing we want to do is just check and see if they're able to wake up for us. And they're not. So Travis, can you go call 911?
Yep.
For me? All right, perfect. So we're going to quickly expose the chest, put the heel of our one hand on the lower half of the patient's sternum, and start compressing at a rate of 100 compressions per minute, trying to push approximately 2 to 2.4 inches deep. We also want to make sure that we allow the chest to come back to its normal position in between compressions. And then the American Heart Association suggests switching out compressors at least every 2 minutes. So Travis, I'm probably getting ready to switch out here pretty soon.
Sounds good.
Are you ready?
Yep.
Okay. And I'll be watching for EMS to arrive so I can flag them down and guide them in.
Yep, you can use the Bee Gees, Staying Alive, to keep yourself in rhythm, or for those younger folks, maybe Baby Shark. I think all of us parents probably experience that.
It looks like the patient's starting to wake up. Their eyes are opening. They're starting to breathe again. So we can essentially just support the patient now and look for our EMS providers to come in and assist transporting the patient to the hospital.
All right.
Okay. Good work, you guys. All right, thank you so much. And I think it's important for people to know, too, once you call 911, the dispatcher will talk you through this.
Yes.
So if you don't know what you're doing, you have someone there on the other line to help. And I've heard a lot of stories about that. Yeah. And it's especially important because, Travis, as you know, so many people have cardiac arrest in their homes.
Yes, up to about 75% of cardiac arrests outside of a hospital happen in the home. So odds are it's going to be a loved one or someone close to you. So it's absolutely crucial to be able to jump in there. It's kind of a chain of survival, right? Making sure that you're doing compressions. By the time EMS gets there, they can do their thing, get to the hospital.
And if you have that skill already, you can stay calm, and the person on the other line can kind of walk you through it.
Yeah, they actually are trained in giving CPR instructions.
Yeah.
Dispatchers are.
Okay, so you can get more information on
heart.org/Wisconsin.
And you can learn yourself.
Absolutely. Watch some videos, 60-second video, and you could be a lifesaver.
Okay, thank you both so much. Thank you.
Thank
We'll
you.
be right back.